Okay, this is Bobby with Macon Media. We're waiting on the commissioners' meeting to start in about 3 minutes or so, or until all the members arrive.
How are you? Good. How are you? Good.
No.
What you need?
Where Jim had compressed the talking points in that Jim Gray thing.
Derek's gonna touch on it.
Have you got copies of that where you
It's on
compressed?
It's on the agenda.
Oh, it's in the, I didn't see it.
Should be in there. Andy emailed it to us.
Yeah, we got an email, I know, from Derek on it.
Right here.
Did it compress? Is that the compressed copy? Let me look at that. Let me see if I can find it in my
All
email.
right, let me see.
Was it from Derek?
Derek wrote it.
Yeah, Derek prepared it.
It's my name on it.
Did you get them on there? 2180.
Yeah.
This is the third time.
Yeah, I got it, didn't I? I guess I just.
How are you?
Good.
We got more people here.
When we start, that's why I don't problem. We got no, he was here, I saw him. What's that? Most time. Got to,
You need free work. Don't try to see plenty. A little bit. Right this
There he
day.
is.
It's one of those new big drive. My
You sound like Kevin Corbin.
Well, I was at it in 21.
I seen him.
It
Yes.
ain't gonna hurt.
Get it back to the
All right, we'll call the June 9th meeting, the Macon County Board of Commissioners meeting to order. I would like to welcome all of y'all in attendance. It's good to have some faces in here. Our last couple meetings have been sort of vacant. I will say that as long as we can kind of administer by social distancing standards, we'll stay in here. If it starts to overcrowd, we're going to have seats out in the hallway where you can join us. With that being said, let's get rolling. Are there any announcements? Anybody? We'll all rise, observe a moment of silence. We'll keep 5741's family, Corporal David Head's family in our thoughts and prayers still as they're going through the loss of his life. And I'll ask Commissioner Higdon to lead us in the Pledge of Allegiance.
Pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, we have two items on our public hearing for tonight. I'll go ahead and open that up. First is the recommended county budget for fiscal year 2021. Is there anyone in the room that would like to address the board regarding the 2021 budget? Mr. Manager, I presume I'm going to know if we have any phone calls regarding either public hearing. Okay. Any questions, comments? I think we've been through this fairly well. Mr. Hagan, everybody good? Chester, do you want me to close this one and vote on it, or would you prefer to go through both?
I think it'd be appropriate to close this one at the appropriate time and then open the next one.
All right, I'm going to give it about another 15 seconds, see if anybody needs to phone call in regarding the budget.
Just one thing in the minutes, Mr. Chairman, I'd ask that it be part of the minutes that we review the budget in approximately 6 months, just see where we're at, or before that, if any commissioners call.
All right, I'm going to close the public hearing regarding the fiscal year 2020-2021 budget. Any further comments? If not, we'll accept a motion to approve as.
Probably need to come out of the public hearing before you vote on that.
I thought I did.
Oh, okay.
I hit the gavel.
All right, good.
Yep.
Make a motion to be accepted as presented.
Okay, we have a motion on the floor by Commissioner Shields,
Second.
second by Commissioner Bill.
She had a question.
Sorry, Lori, go
Sorry.
ahead.
The budget approval is contingent upon whether or not y'all do the small business loan, because there's option one that has it and option two that doesn't, or vice versa. So you might want to really have a public hearing on the small business loan first and act on it before you act on the budget. Does that make sense?
I don't think you have to act right now on the budget. You just need to close it before you go into the next item.
All right. So I guess we'll just
So you withdraw
hold
your
your motion.
motion,
Just withdraw your motion.
and I withdraw my
Okay.
second.
Okay, I'm gonna go ahead and open up the reopening Macon COVID-19 Small Business Loans Program.
In your agenda package, I'm sorry, as a supplement to your agenda package, you have a resolution of the board establishing the reopening of COVID-19 Small Business Loan Program and approving the attached agreement with Mountain Biz Capital, Inc., North Carolina nonprofit corporation, to administer the same on behalf of Macon County. If you'll look on that resolution, attached is the actual agreement between the county and Mountain Biz Capital, Inc. for the actual loan program. At the last meeting, this board instructed myself, Tommy Jenkins, county manager, to look to see what could be done in the way of setting up a loan fund. Mr. Jenkins had recommended that the fund be increased from the $250,000 figure that had been discussed at the last meeting to $257,500 to cover some of the fees in connection with the origination of the loans and closing out of the loans. So that is the number in the loan fund. Mountain BizWorks sat down with us and worked through a proposed agreement for originating these loans on behalf of Macon County, securing promissory notes and appropriate collateral for those, as well as servicing those loans for the period set forth in the agreement. These loans are designed to be hopefully short-term loans, bridge loans, if you will, to allow for small businesses in Macon County who have been adversely impacted by the COVID-19 pandemic to come in and secure some small loans that would get them through until perhaps they can get into some of the federal government money and state government money that is a little bit slow in arriving.
Mr. Chairman, this is a program that I discussed with Mr. Jenkins and other members of the board. And we have several folks here who would like to speak in the public hearing. I would just like to remind the board that the Chamber of Commerce, which is represented by not only Linda Harbug, but Cindy Cavender sitting in the back, there's almost 500 small business, 500 members of the Chamber of Commerce. About 400, less than over 90% of those are considered small business in Macon County, and that's a tremendous amount. As we all know, a lot of them are, and you can't go to the bank and borrow $2,500. You can't go borrow $3,000. You might go to Home Credit and pay 30% interest and do that. But I just think this would be a bridge loan. But we'll let some of these folks speak to it. Tommy, do you want to?
Thank you, Chester. Are we going to do the public hearing?
This is the public.
Yes, public hearing.
Oh, okay. Well, I'll let my folks speak first then. Corey McCall? Yep. From Map 476.
Welcome, Corey.
Welcome. Thank you guys for letting me come up here to speak. I just wanted to encourage you guys to consider this program. We've been in business for 10 years and never would we have expected to be faced with such dire circumstances through our busiest time of the year with through hikers. And we have talked to a number of people, not only in our industry, but other people here in the community that are small business owners. And I think that this program is going to be really good for businesses that really do need an extra boost of money. And I think that it was evident with the PPP loans and the EIDLs that there was a disconnect to what local Main Street needs. And these, looking at the terms of what's laid out, I think it's wonderful to see that these are going to be incremental loans that will help people get through that really do need it. And I think that there are a number of businesses here in Macon County, a number of people that own businesses that I've directly talked to that could use funds from this. So I would definitely encourage you guys to consider it. And I appreciate Tommy stepping up and anybody else that's been a part of this and being able to search for additional methods to be able to help keep small businesses going. I think the next year is going to be a very eye-opening experience to see the number of small businesses that fell across America on Main Street, USA. So I appreciate it if you guys would consider it.
Thank you, Corey.
There we go.
Good, welcome.
I'm Tim. I think we all know who I am. Of course, everything Corey said I agree with. And being from the restaurant side, I think it's really important to consider these types of small loans. And like he said, with the federal loans, there were big stipulations, on where you could spend the money. And that didn't take into account that, like with restaurants, we had, when we get food in, fresh food, we have 7 days to use that food. Well, when we were all shut down, things like that might have gone bad. And so, we may have lost $1,500 worth of food or $5,000 worth of food, which doesn't really seem like a big number, but when you're operating on, a 4 or 5% profit margin, $5,000 can change your whole year. And that happened in a matter of a couple weeks. Of course, with my business and lots of other businesses in town, we employ 33 people, which isn't a lot, when you look at like the school system and the county and Drake Enterprises and some of these bigger manufacturing companies. But when you put all of us small businesses together, I have 33 people, Corey's got a number of people, and all the other businesses have all these people combined. We're the biggest employer, in Macon County when you add all the small businesses. So I think it's really important to consider these small loans just to bridge the gap to get some businesses through so that we can survive as small business owners. So I appreciate y'all hearing us. Thank you.
Good, thank you.
Thank you.
Linda?
Good to see all of you. It's been a while since we've got
Welcome.
to have a meeting together, hasn't it? Just want to speak on behalf of this fund, this loan program. Some of you know me. I'm not nearly as old as Paul Higdon, but we graduated together somehow. But anyway, the thing about it is, I've been with the chamber for almost 50 years now, and I have never seen times like we're having. And the number of past due bills that we have for chamber membership is enormous right now. The number of small businesses who have not been able to even pay $200 for a whole year of membership in the chamber, have not been able to pay. And that breaks my heart, because I just think that the small businesses, without them, this county and this community wouldn't be the same. That's what makes us. And we really need to help our small businesses, all of them. And without this fund, they don't have an opportunity to get help, except for what's already been put out there, and we know what's happened with most of that. So my idea is, if there's nothing there, they can't ask for anything. But if there's something there, then it's up to them to come or to apply and try to get a small loan that they feel like they would be able to pay back in the amount of time that they have to pay it back. So I really encourage this, because, like Ronnie said, we have 400 small businesses that are members, and that's real personal to me. So I would appreciate y'all supporting this loan opportunity for small businesses in our community. Thank you very much.
Thank you.
I'll take it a second, Mr. Chairman, members of the commission. I would like to submit a couple of other letters of support. One from the Highlands Chamber of Commerce, from their executive director. You want that, Chester?
If you give that to the county manager as the clerk of the board, and he can include that in the minutes.
And also the Franklin Chamber, which Linda was nice enough to come by. Thank you, we appreciate it. Also, on May 12th, the date that the board directed us to start looking at this program, 2 days later, the Macon County Economic Development Commission met and unanimously approved moving forward with this program, so continuing to develop it. So that being said, I would appreciate your support, and I guess when we come out of this public hearing, we can have some further discussion.
All right. Thank you, Tom.
Thank you, Tom.
Anyone else? All right, any questions from the board? Comments?
One comment. I appreciate Tommy's work on this, as well as Commissioner Bill's work on it. When we talked about this at our last meeting, I started asking some of the subs that work for us and subs that we work with out on jobs, and ask them about what they thought about this program. And their ears perked up and they listened. They thought they were interested in it. And many of them brought up a point to me, and that is they're already strapped for cash. Their budget, and Commissioner Beals talked about this before, their budget's based on what they're taking in every week, and whatever it is, they're going to spend it, some of them, a lot of them. And they had some real concerns about the value of the program, where they had to pay the money back, versus the value of a program when they didn't have to pay the money back. So I appreciate the effort that's been put into it. I wish that there was a way that we could turn this program in to a grant program instead of a loan program, because I think that's where the real value in this program is for someone who is really struggling, and I'm making up a number now, but $2,000 or $2,500 can make an impact to keep them in business and get them over the hump. I know with me, the bank says they come once a month, but it seems like those payments come more frequently than once a month. So if there's any way that we could look into this program becoming a grant program, whether it starts out as a loan program, and Tommy, you can speak to this, that we can make it evolve into a grant program. While I think it has a lot of value as it is, I think there potentially, from the feedback I'm getting, there'd be a lot more value in the program.
With respect to the concerns about people being strapped for cash and whatnot, that clearly is a problem in this circumstance, no question about it. However, this program, the way it was structured, and as you'll see in the documents, if you decide to entertain a motion in connection with the resolution, these loans will be structured where the first 6 months there won't be any payments. In fact, there won't be a payment until month 7. Is that right?
That's correct.
And hopefully that takes care of, not completely that concern, but it certainly allows them to get a little bit on their feet.
I think it does on the surface, but I think as some of the folks that spoke, over this next year, it's going to be a shoestring from month to month. I appreciate what you're saying, Chester, and agree to an extent, but I think that is not a substitute for if there was any way that we could forgive that loan.
Well,
and likewise,
Commissioner Gillespie, we did have that conversation, Tommy and I and some other folks in this room, about making it, but what we came to the conclusion, and after talking just like you have, and I had some of those same concerns brought to me, but we feel that any business that qualifies for this loan, the qualifications are outlined, that having to pay back instead of just giving it to them, to that business, a lot of them said that might motivate them even more to get their business instead of just giving them the money. We try to make it as liberal as we could on the payback, but I believe in the future, Commissioner Gillespie, if this is any consolation, that really any of these businesses would have to show that it's a hardship on them to make a payment. And I believe Mountain BizWorks would work with them. We know the county will. And I believe Mountain BizWorks would do the same. But we thought, and I've always personally thought that if you got skin in the game, it's a motivator. And the ones I've talked to, and that's been several, none of them disagreed with that. So it would be nice if we could just make it a grant program, but we also, with that, I think could be setting a precedent down the road that would be hard to turn around. If it may not be a COVID, it may be something else. But with a loan program, it puts everybody on the same footing, same applications. And so that was where we left the conversation. And we decided that, if after 6 months, you'll pretty well know. But if there are a hardship there, I'm sure that Mountain BizWorks and Tommy and this board will work with whatever business it is. If we see we need to extend that out, we have the ability to do that. So that was the conversation that we had, and that's since we talked before. So just so we, but it would be nice if we, I think if we establish as a gift that I think over time, when this board is no longer here in the future, it may bring up more difficulties. I'm the one who's concerned about that. And I think if you give somebody a loan, they said it would be a motivator. And first of all, they were appreciative that the county would step up to help them, because some of these businesses without this, they're not gonna make it. They're just flat not gonna make it. So that's where, but I appreciate Commissioner Gillespie's thought on this, but I wanted to pass along some conversations that we've had also.
Thank you, sir.
Can I say something? One other thing?
Sure. Go ahead, Tom.
I did talk with Commissioner Gillespie, and he was kind enough to send me some examples of what he was talking about. I did tell him that I would look at those programs and see if there was anything possible in the future we could move in that direction. Correct? So,
I appreciate that.
Thank you.
Good.
Funding for this, was that EDC money or?
yes, EDC Fund Reserve.
This fund was established back in 2000 and had never had a whole lot of money put into it. We really started putting money into it in 2006, 7. We had to skip a few years there when during that big recession. Matter of fact, there was some money reverted back to the fund, to the general fund, which this board can do at any time. But since then, we've been able to build the fund up, and I think now the balance is what, Tom? Roy, you know off the top of your head? It's over 9, it's close to $1 million. It's not over.
Any further questions?
Thank you, Tony.
Okay.
All right, anything else? Anyone else? All right, we'll bring us out of the public hearing. Any discussion or a motion considering the same?
Mr. Chairman, I'd like to make a motion that we approve the resolution establishing the reopening Macon COVID-19 Small Business Loan Program and approve the attached agreement with Mountain BizWorks Capital Incorporated. They're a nonprofit corporation to administer the same on behalf of the county and authorizing the county manager to have the signatures as appropriate.
All right, so I presume we're going, on your motion here, I presume that's going to be the consideration of the resolution to approve the reopening Macon loan program and the consideration of the resolution to approve the funding source.
That's right.
So it'll be both. Okay, we
That's
have a motion
all
by
inclusive.
Commissioner Bill, a second by Commissioner Gillespie. Any further? And we'll vote on this, Chester, then we'll do the budget. I
Yeah,
presume.
there are actually 2 resolutions that I prepared for the
I
board.
tried to include them both.
I think
You did.
Yeah. I got it.
And
Any
it
further?
contemplates the chair executing this one, so.
Okay. I'll take care of that. You'll amend your motion there.
I'll amend the motion, let the chair have it.
Just one more signature. All right. All in favor, signify by saying aye.
Aye.
All right. Thank you, gentlemen. Thank you, Tommy, for your work on that.
Good luck,
Thank y'all for
Tommy.
coming. Y'all are welcome to hang out with us if you'd like to.
Oh,
Or step
yeah.
out.
Thank you, Corey.
Consideration.
Thank you.
Yeah, thank y'all. Consideration of approval of the fiscal year 2021 county budget and budget ordinance using the proper option based on the action taken, which we just passed.
So you need to pick option 2,
Option 2.
which the Economic Development Reserve Fund is $664,500.
Okay.
So it's $664,500. So that, which is option 2.
Okay. So we had unless there's further questions or comments, we had a motion by Commissioner Shield. I presume you're good with that with option 2. The EDC Reserve Fund going to $664,500. We had a second by Commissioner Gillespie. You still good with that?
I think I second.
He seconded.
Yeah.
All right, sorry for my confusion. And a second by Commissioner Bill.
Don't worry.
All right, let's go into discussion. Any further discussion on the county budget?
I
Mr.
just
James?
think again, Mr. Chairman, we need to thank our finance director and county manager for their work on the budget like no other that we've seen,
Yeah.
that a lot of us have seen, so we appreciate it.
I agree. As I've had numerous conversations with the county manager about it, I think he's stated that he didn't want to have to go through too many more of these budgets. But from our perspective, Derek, it's probably the easiest one. I know it's the easiest one I've had as a commissioner. Because you did all the hard work behind the scenes. So thank you, and that's definitely recognizable. And I know the countless hours that you spent and the countless hairs that you've lost. Just don't go to looking like me. So with that being said, all in favor signify by saying aye.
Aye.
Aye. Unanimous vote. All right, public comment period.
Mr. Chairman, I think we do have a call in. Let me see here. have a caller on the line.
I presume they're gonna buzz us on this phone?
Yeah.
We're ready. My IT director is on top of it.
That's how it is. Just pay attention to paperwork. Gonna be logged in.
Hello.
Hi,
Hey, this is
who am
Jim.
I speaking with?
This is Jim Tate.
Hey, my name is Felisa Henderson, and my husband and I live in Macon County, and we're outside the noise ordinance area. And I wanted to know why there was no noise ordinance out here. I know some of the reasons, but we live sort of in a subdivision, and we have a neighbor that has 3 large coon dogs. And he's only, he's maybe 100 feet from us, and those dogs bark all the time, day and night, 24/7. What can we do? I mean, I've called animal control, and you know the story there, so how come there's not a noise ordinance?
There is.
We actually do have a noise ordinance. Go ahead, I'm gonna let our attorney respond.
There is
Awesome, thank you.
there is a noise ordinance for Macon County, unincorporated portions of Macon County. And I am going strictly from memory right now, and my memory may not be 100% accurate, but I believe there is an exclusion from the terms of the noise ordinance for dogs.
Oh, okay.
And part of that is, if you dig deeper, Mr. Attorney, it's also a law about hunting dogs, and if you have them kept in a certain way, and if they are in a compound, it goes beyond this board. I think we've had that discussion many times, and so
Okay.
Ms. Henderson, I think that it goes beyond this board as far as when it comes to dogs.
Okay. Well, we called animal control, and they said there was nothing that they can do as long as they have food and water.
And shelter.
Yes.
Hi, this is Tom Henderson. I'm Felisa's husband. What's the process involved in getting that law changed so that nuisance barking can apply in the county just like it does in the city of Franklin?
Kevin Corbin would be your best bet. Representative Corbin.
Camden Corbin?
Or Senator Davis.
Okay, what is their position?
Senator Davis and Representative Corbin. They represent this district.
Okay.
Yeah.
All right. So that would be our only resort, would be to try to get the law changed through, have them to bring up a bill and change the law.
Especially when it comes to coon dogs and to hunting dogs. It specifies sporting dogs in particular. And so that would be your only, I think it's above our pay grade, Mr. Henderson.
Yeah. Well, it almost sounds like we live next to a kennel.
And it's miserable. We can't even sit outside. We can't open our windows. It's awful.
Yeah, I feel for you. I'm not sure how much we can help, but I understand where you're coming from.
Are they in a subdivision?
Do you have any
Well, we're in Coon Creek. We're in Coon Creek, which is actually a subdivision. If you look at it is drawn up as a subdivision.
Are there any
But it's outside the noise ordinance.
Are there any restrictive covenants for the subdivision?
No.
There is not.
You might want to contact an attorney of your choosing to see if there are some potential civil remedies available to you.
Okay. Can you give us the name again?
I'm sorry? Just an attorney of your choosing.
Anderson. Oh, okay.
Yeah.
All right. Okay.
Thank you, Tom. Thank you,
Well,
Felicia.
thank you so much for your help.
Sure.
Thank you.
Just as a FYI in regards to that, I had been emailing back and forth with those folks. County manager was involved in that, and there was a wellness check made at the location that she's talking about, and everything was found to be as it should. So the county manager and animal control, that what we have the latitude to do hasn't been done.
All right, thank you. Any other calls, Mr. Manager, that you're aware of?
No, sir.
All right. Is anyone else wanting to speak during public comment? All right, is there anybody out in the hallway by chance? I can't quite see.
Warren.
Ms. Warren. He'll have his moment. All right, we'll move past public comment. Any additions to the agenda, Mr. Manager? I think you have
Yes,
couple
sir,
items.
Mr. Chairman, thank you. If we could add under old business item number 10C, that will be a discussion regarding the Macon County Board of Education underground storage tank removal. And then consent agenda, if we could add item number M, that'll be under 12 consent agenda M, renewal of the TICO lease at the Business Development Center. Item number O, contract with the Highlands Chamber of Commerce.
That would be in.
That will be in, yes.
Yep.
Contract with the Highlands Chamber of Commerce for fiscal year 21. And item number O, contract with the Franklin Chamber of Commerce for fiscal year 21. Then under appointments, number 13, add item number B, and that is the reappointment of Commissioner Shields to the SCC Board of Trustees.
Mr. Chairman, in connection with those items that would be added to the consent agenda, the TICO lease and the contract with Highlands and Franklin Chamber, I have provided the county manager with the documentation for that to be included in minutes.
Okay. Thank you. Any other items? You want to discuss that? Which y'all discussed at the Region A, or the meeting the other day regarding.
We're on here, either one can talk about
You wanna
that.
add that on the agenda?
The chief's letter that he sent out.
Yeah. If you're not familiar.
You want to add it to the agenda?
Yeah.
All right. Let's add it as under new business. We'll add it
Yeah,
as
that's new
11C.
business.
What's that, Mr. Chairman?
It would be new business concerns from the Eastern Band.
Eastern Band, yeah.
It'll be C.
Yep, C. All right.
Thank you for remembering.
We'll get a motion to approve the agenda unless there's something else needs to be added to that. You got a motion to approve? Got a motion by Commissioner Gillespie.
Second.
Second by Commissioner Higdon. All in favor? Aye. All right, reports and presentations. Update on Via Health activities. Ms. Shelley Foreman, welcome, Shelley.
Thank you. Pull that down. So I have to tell you, this is my first face-to-face meeting since the stay-at-home
Well,
order.
welcome.
So you're number one. And I did make one other trip over to Macon County to No Rhyme Door to bring some Narcan. So this is my first foray out into the world. First, before we start, I just have to, and I know he's not in the room right now, but I've had the pleasure of being able to participate in some of the emergency management calls with Warren Cabe and Kathy Magaha, and boy, your county is very lucky to have, I told Warren if I have an emergency of any kind, I'm calling him. So organized, so wonderful, just so great. I mean, I know that, that they have been working really hard, so I just wanted to show our appreciation from VIA for all the work they're doing. course, we always thank Commissioner Beal, his work on our board and our chair of our County Commissioner Advisory Board. He really works hard for people with behavioral health issues in the community, and been working with him on the No Wrong Door program, as well as hopefully once we get through sort of the next month or two, be working with both Commissioner Beal and Shields. I'm working with the high school to look at sort of how we're going to maybe support them in doing behavioral health services in the school. So I just want to take a moment of your time because I know you have a lot of reports and a long agenda, and I sent you a lot of information, but I just did want to give you a highlight on some of the activities that BIO was doing during the pandemic to try to support people in the community as well as the providers we serve. I will say that the Department of Health and Human Services has really been a great partner with the LME MCOs across the state and working with the Center for Medicaid Services to make things happen more quickly than we ever could have imagined as far as work in the Medicaid world. Our priorities have really been about ensuring that providers who did walk-in services, crisis services, that we were supporting them at the front of the line, and also working with providers that have facility-based or group types of programs. I know you've heard a lot about the adult care homes and how dangerous those are. But in our network, we have homes for people with developmental disabilities. We have people with mental health issues living in congregate settings. So really trying to work hard with them to make sure that they have the PPE they need, that they have the procedures in place, and as you'll see, that the funding they need to keep going. So just a few of the things we've been able to do, and most of these things, of course, have been in collaboration with the state, is the state did release the final quarter of funds for indigent care, the single stream funds that we get for people with no insurance. So we were able to, instead of making our providers wait, get that money out to our comprehensive care providers so they would have that money to use. The other thing that really helped people, especially who are with no insurance, is we were able to secure a grant to continue the folks who are doing medication-assisted treatment here in the county that have opioid use disorders, so they were able to continue their services. There have been all kinds of changes in Medicaid flexibilities to allow for telehealth, virtual visits, even telephonic visits if somebody couldn't make connections. One of the things we quickly found is even though providers were able to do it, we had to support them with some of the technology they needed to do it, but also many of our members out in the community did not have smartphones, or they did not have the technology. So we were able to work with Verizon to purchase smartphones that our comprehensive care providers have now been able to distribute to their members, so that if they want to do a virtual call, like FaceTime or Zoom or even telephonic, they're able to get that. So that's been really helpful. One of the other things, and I'm not going to go through the whole list, but I did want to highlight one of the really hard things that has happened for both child providers, residential providers, and people who serve people with intellectual and developmental disabilities is many of their direct care staff were not able to come in. We created a hardship fund so that for our providers who are really either struggling to maintain staff, or who were losing staff due to the virus, that we were able to help give them funding to be able to maintain their operations and not go out of business. So we've done a lot of things to try to support our providers. I think one of the things I find fascinating is that every single system has been impacted, and we know for people with mental health and substance use issues that this is really something that will probably continue to grow. I know, Ronnie, I don't know if there are any things you want to talk about what you've been working on at the state level. But are there any, because
we have constant communication with the DHHS about hunting money for our rural counties.
Yeah.
That has helped. Of course, a lot of that money is still within the budget of the state that has not been passed. They are looking at a mini budget to bridge some of those things in mental health and substance abuse, but the needs, regardless of the situation on the outside, those with this problem in our area and everywhere the 23 county area continues to grow. I mean, and when you of course, I'm no expert on nothing, but, when a situation like the virus, it don't take much if that person has lost their job. It don't take much for them to regress very quickly, and we've seen that. And every day at No Wrong Door, especially, and the folks that's coming out of the jail, there's nowhere for a lot of these folks to go. And so we've been searching for money for that. So Shelley's done a wonderful job of keeping in touch with all of us. And on the state level, we're just hoping that, when they do appropriations and they do it by quotas, it's tough on us. When you get far west. You've been here a long time, Shelley, doing this in the far west, at least 5 years or so, right?
And so one of the things, because we're very concerned about our providers, just like you, I heard about your wonderful fund you're starting for Macon. We at FI are very concerned that our providers can have the stability they need to maintain business, because as the pandemic started, people were missing appointments or they couldn't get to them, they weren't able to bill. It took a while to get all these new Medicaid flexibilities. So our main goal is to maintain our provider stability to ensure that people in your community get the services they need. That's our number one goal, and you can see the long list of things. It includes things like housing, supports, all kinds of supports to wrap around them to be successful. So the one thing we have asked of the General Assembly, and you have those documents, is with every other system asking for a one-time COVID-19 disbursement allocation of about $81 million to go to the whole state system, all of the LME MCOs, to cover all the costs that we have had. In your documents, I won't go through it, you can see how we've overspent already, what those fundings were, and every other system in the state is asking for that kind of funding. The other two things we would ask you to advocate for, again, is right now, we haven't seen if we're going to have additional state funding reductions, but we hope we don't. We hope that those would be restored. People without insurance really need the care, and unfortunately, there are going to be more of those as the pandemic continues and people have unemployment. And then lastly, really asking for an expansion of slots. There's a whole system the state has where there are only a certain number of slots for people who have developmental disabilities to get on the innovations waiver, which provides them a wide variety of care. Those slots have been frozen. We're asking those to expand those so that people don't have to be on a wait list to get those kinds of services for years on end. So I'm happy to provide you with more information, but you have Commissioner Beal, who stays on top of things. But please know if there's anything that VIA can do for any of your community partners, we're always here to help.
And Board, we're still working very diligently to get our BHEC back open at Balsam. That's been a real deterrent. We have found the BHEC in Asheville. We're wiring them out now.
I know. I've sometimes.
We've also found a great partner in Pardee Hospital.
Yeah, great.
They're on a different level when it comes to mentally ill and substance abuse. We now have 4 from Macon County at Pardee, and so we appreciate those relationships. And ADAC does all they can. Balsam stays completely full, no beds available, and but that emergency walk-in service for our area, that's a huge loss, and we keep beating the drum to get that money, and it should be funded. There's no reason why it's not funded. So, but we appreciate Shelley too. She works hard at her job, and you've been there for how long, Shelley?
21
representing
years.
us far
Almost
west.
22 years I've been here.
Yeah, and
I'm old.
so.
Well, thank you. And like I said, hats off to your folks here, the health department, Warren, and all the other partners that have just been doing a great job. It's been a pleasure to work with them.
Thank you,
Shelley, could you,
I'm sorry.
you elaborate on some about telemedicine? What is the history of that?
Telemedicine is like the ability for our providers, instead of a person walking in, although they can still go to the walk-in center, is to use like a smartphone to do, it can be FaceTime. They've loosened up the flexibilities. It can be like a Zoom call, or it can be a virtual, like where they call in and there's the screen. If they have a computer and there's a phone, they can see somebody, quote, face-to-face virtually. And even things like peer support can be done that way. all kinds of outpatient services. They've done things where they've been able to do Zoom groups. They've gotten very, very creative to do that kind of virtual kind of communication with people that they serve.
So you do have the broadband services?
We've
problems?
We've been working, we have the smartphones that are loaded with the technology and the data plan. What we're having to work with in each county is, for instance, here in Macon, they can, if they don't have the connectivity, they can go up to the Appalachian Walk-In Center and do it from there. They can find a hotspot. They're trying to identify locations and get Wi-Fi's out or Mi-Fi's out to people so that they can use to do it
But
that
you
way.
still have to leave their home, a lot of them do, or?
Most of it, I mean, it depends on where. I think here in Macon, there's always places that don't have coverage, but I think they're being more successful, and they're still doing face-to-face work. They're still doing face-to-face. So it's just an option for people with COVID.
And that's here to stay, long after this is gone.
We hope.
It was called telepsych for a long time.
Right, exactly.
And the hospital has had it, I guess, now for 6 years.
Yeah.
And it's been fairly successful. It has more, and now Appalachian has one on staff.
Mm-hmm.
It took a long, long time to find one that would work in this area, a psychologist or a psychiatrist. So, but the tele-hits has really been a blessing.
All right, thank you, Shelley.
Thank you.
All right.
Thank you for your time.
Sure, thank you.
Bye, Sheila.
Update on the county's response to COVID-19. Kathy McGaha, Public Health.
Just calling in.
All right.
Kathy was calling me. She didn't know if she needed to call in or what, so.
We're ready for her.
You should be calling.
Okay.
Is it the number out here? Or is it your cell phone?
She has the number.
Okay. She said she has another number. What's the number?
349. Mr. Manager, if you choose the last one.
Warren, would you like to go? You want to wait on her first?
I was going to defer to her first, but.
Well, that's fine. I mean, we can wait on her. So.
We'll call her.
She's calling.
She's calling?
I gave her the number. She didn't have it. That's Kathy.
Hey, Kathy.
Wonder who that is.
Hello, Mr. Tate.
Welcome. We're ready for you. You're live.
Hold on, mute my. Hello, Mr. Tate. Okay. So I wanted to bring to you an update on some of the COVID information and the case numbers, as well as some of our testing numbers. Can you move to the next slide? So in the state of North Carolina, we have 37,160 confirmed cases, and they've completed over 500,000 tests across the state. There's 774 people that are currently hospitalized for serious COVID conditions. You want to move to the next slide? western North Carolina counties, you can see that Macon County is has the third highest number of cases, behind Henderson County, which has a lot of cases that are related to nursing homes, and Buncombe County, which also has some cases in nursing homes. Next slide. Here's just a map that shows the different counties and how we are standing out in what the most western counties is having the highest number of cases. 157 cases as of today. Next slide. This graph shows the impact of some of the phase openings over time. You can see with the navy blue line there, that is the beginning of phase 1. The red line indicates the beginning of phase 2, and we can see the sharp increase in cases that we've had past the opening of phase 2. Right now, we currently have, out of the 157 cases, we have 139 active cases where we are doing contact tracing and calling to make sure that the person is okay while they're in isolation and has what they need. We have 17 people that have actually come off isolation orders, and of course, we've had the one death in Macon County.
Kathy, how many of those are hospitalized?
Out of the active cases currently,
Yeah.
I know as of last week we had, or 2 weeks ago, we had 5 that had been in the hospital, and I think that since that period of time, we've had 3 more people that have been in the hospital since then.
What about today?
I don't know the actual number of people that are in the hospital today.
Okay.
Kathy, this is Carl Gillespie. Do you have, I may be getting ahead of myself and asking this, but do we have a graph in the presentation that shows the number of tests that we've been doing in regards to the number of cases that we have?
We do have a graph in a couple of slides. If
Thank you.
We'll get to it and we'll talk about that some more.
Thank you.
You're welcome. So next slide. So here's where the testing, the numbers that we have tested. For a total in Macon County, as of today, we've tested 2,227 different tests. Some of those tests are a few repeat tests, a very minimal amount are repeat tests where we are trying to make sure someone is negative before they come off of isolation orders. The health department and the EMS have worked together to do 1,815 tests. We've had 174 at the hospitals that are here in Macon County, and 117 at hospitals outside of the county, and other providers, which are local providers and other health departments, make up 121 tests. So you can see we've done a tremendous number of tests in the last several weeks.
How many do you have pending, results pending now, Kathy?
I think you'll see in the slide we have, yeah, if you'll go to the next slide.
I see it now, thank you.
I'm waiting for it to come there. So out of the tests that we have conducted there for the county, actually, there's 319 tests that are pending. So I know even today they did 175 plus a few, like around 180 tests up in Highlands today alone. So, of course, those tests are pending.
Now, in Highlands, can anybody that wants a test get a test?
We're still trying to use a criteria that you need to either have been exposed or you think you've been exposed to at some level, or you're currently having symptoms. We just don't have quite the capacity to open it up free to just anyone. We wish we could get there. I think the biggest concern is having the capacity of staff to do that number of tests. And we would love to be able to do that. It's having the people. You can skip the next slide. Just list the counties that we're comparing.
Do you expect that 157 number to climb after these 300 and some odd test results are returned?
Yes, absolutely. So you can see, compared to the other western counties, we have a significant number of more positive cases than the other western counties. You'll see in a couple more slides that we are testing more, but we do have a pretty significant increase in number of positive cases in Macon County. Go to the next slide. Okay, so you'll see in this slide where we have tested over 2,000 different tests, and other counties, they're close to us, but like for example in Jackson County, there's probably about 5 different places you can get tested, and in Macon County it's us. So there's a big difference in the amount of people that are performing those tests than we have here in Macon County.
Are you still just using the swab test, Kathy?
We're using the nasal and the oral swab test, the PCR test.
Okay.
It's not the antibody test, it's the actual COVID virus test. You can go to the next slide. It takes a minute for the computer to catch up. There it goes. Okay, so for the percentage of tests that are positive, you can see that we're actually Macon County, we have a higher number of percentage of the tests that we do conduct that turn positive, that are positive than the other counties. And if you'll go to the next slide, when we got some directives from the state, we were encouraged to test approximately 5% of our population. And so, considering those population numbers that you see in front of you, then we were looking at around 1,700 tests, and we've surpassed that by far. If you go to the next slide, we've already hit about a little bit over 6% of our population. And the last slide is just a summary that shows you the difference between the United States, North Carolina, and our case fatality rate. It's it's hard to, so we've only had one death in the county, thank goodness. And so that's a definite small number. We can't really look at it as because of the small number effects, but you can see case-wise how we compare to the United States and North Carolina. Any questions?
Kathy, this is Carl Gillespie. While I think y'all have done a great job testing, getting the number of tests done that has been recommended, it's obvious there's a direct correlation between that and the number of positives that we have. But the percentage of those that are tested is higher in Macon County than in some of the neighboring counties, and I'm not picking on Jackson County, but they're a close neighbor of ours and a lot of similarities to Macon County, and their percentage of positives based on the number of tests that's been conducted is significantly less than ours. Would you care to elaborate on what you think that might be the reasoning for that?
I think that it's due to the level of contact tracing that we are doing. So we are doing targeted testing where we're testing people that we suspect were exposed or they are having symptoms, instead of just a drive-by testing situation where anybody can come if they're curious to see whether they are currently positive. I think with the targeted testing, we are going to see that we are actually a higher percentage of positive because we're going after the individuals that we think are at risk, and we want to make sure that they're isolating. And that's due to our staff doing the contact tracing to the level that they're doing it.
Kathy, how often do you meet with the hospital? You know, one of our concerns is, you know, out of these positive cases that, you know, the last count I had, we're down to 5 ventilators, and our concern is, and we hope none of them get sick. So how often does the health department meet with the hospital in Karen Gorby and go over their preparedness and what do we have now?
We have talked on almost a weekly basis with administration, but on a daily basis, we have staff that are talking with them, with the ER, and the staff that are administering the ER. So more like on a daily basis, we're talking about patients that they have in the hospital, as well as what they're seeing coming through the ER that are not being admitted. Because we're doing the contact tracing with those patients.
Do you know if the hospital is ramping up their availability if some of these folks really do get sick? Where are we at on ventilators? Or is that question probably not for you, or, you know, personal protection equipment? Are we in good shape? It's hard to find that information, even though HCA got about $1 billion in the COVID thing. It looks like we could get a little something.
I think that definitely is their concern. Their concern about having the supplies they need and being ready for when the individuals become sick enough to be admitted, and that they're ready for it. And that's what their focus has been, instead of testing.
Kathy, going back to my question, and I just want to make sure I understand this correctly. Is it fair to say that because y'all are working hard, once a site is identified or a potential cluster is identified, y'all are doing a really good job testing in the areas of that cluster? And would it be fair to say that in a county that was just doing random testing, their infection rate could be as high or higher than ours because they're testing basically folks that are well, where we're testing where we see the potential for additional cases, and that's where we're focusing on. Is that a fair statement?
Yes, that's a good summary of what I was trying to explain. If an individual, think about it this way, if an individual tests positive for COVID, we're going to get a list of that individual's immediate family members that they spend most of their time with, the people that they work with, and any friends or any areas where they've visited while they're in their infectious period. And those contacts are the people that we are concerned about, that they're at risk of being exposed and becoming positive themselves. So that's why we're doing targeted testing.
Kathy, was it surprising to you to see as many young people test positive as we've had?
Yeah, I guess it is a little surprising. When I look more at the statistics, where we are seeing more positives in the 20-year-old, 30-year-old age range, we actually are testing more in the 40-year-old age range. I guess some of the younger people aren't as interested in coming to get tested. So those are the people that are not as concerned as staying at home, and they have to make a living, so they're out and about.
Understood. Thank you.
Kathy, can you tell us if, I'm not sure that you can, but can you tell us if the majority of the new positives are coming from a previously named cluster?
There was quite a few that came from both clusters that were named prior, but we've also had just as many just individuals that are becoming positive, and we can't really explain exactly where their exposure happened, and that's why we're very confident that there's community spread going on. It's in the community. People need to understand that and know that they need to wear their masks, keep their distance from each other, wash their hands. I mean, it's part of our life now, and we need to practice those things.
How many clusters do you have, Kathy? How many institutions, businesses, or whatever has been identified as having a cluster?
Right now, there's two that have actually that we've named that still that have made the threshold of being named a cluster. And that's the Old Edwards Inn, as well as the Ezekiel Evangelical Ebenezer Church.
Any further questions?
Kathy, one more question. Of the number that have been tested, how many of those folks are, this is probably the wrong way to ask it, but are actively sick? How many of them are sick, showing symptoms, that kind of thing?
Surprisingly, not as many as, so there's asymptomatic individuals, people that test positive and they're not showing symptoms. We've had a majority of those that are asymptomatic that are testing positive than the ones that are symptomatic and testing positive.
So most of the folks are trucking along and don't even realize that anything's going on.
Correct. If their symptoms are so mild, if they have any, that they're not realizing anything's going on.
Thank you,
They're totally asymptomatic individuals.
All right, any further questions?
Do we really know if these people that's being quarantined are quarantined? Are they staying at home? Do we know that, Kathy? Or we just trust that they are? Or?
So we're doing follow-up phone calls with the people that are in isolation that are positive. Every day they get a phone call that asks them, about their symptoms, as well as how are they doing and do they have what they need, so forth. And there are definitely some that we can't get a hold of, and we have concerns that people are still working. We have concerns that they're in the community. That's where where we work with the different businesses, and we work with the, if I need to work with law enforcement, I will do that to contact an individual to make sure that they understand that they need to isolate. But not everybody's as honest as I would like them to be.
All right, thank you, Kathy.
Thank you.
All right, Mr. Cade.
I don't have a lot to add. Kathy did really well, and y'all did a really good job of deciphering the numbers that were there. Obviously, we've been helping her do some remote testing, and we are doing targeted testing at those for the most part. However, one of the things we did is if somebody showed up, we intended to get people that were exposed or were ill, and obviously if somebody showed up and got in line, we didn't turn them away. So we did catch a little bit of the general public, and I'm a math person, so that's to me what we're trying to get at now. I get where the numbers are. Out of the 2,000 or so tests, there's 157-ish that are positive, which is about 7.5%, somewhere in the neighborhood. So if you take 7.5% of those people that thought they were exposed or had an exposure, and then there's a very low number of those that are actually symptomatic, then obviously, we have a problem, but it's not a huge widespread problem. So I don't want the public to take the numbers in the wrong way and start panicking over that big increase. We knew those numbers were going to rise. We didn't necessarily know that they were going to rise in a period of 14 days, but we knew we were going to get there. But you have to remember that for about 10 to 12 weeks, we were at the bottom of the list. We had 3 cases for probably 10 weeks or more. So when you're at the bottom, you have nowhere else to go but up. It wasn't totally unexpected that we were going to have those numbers. It's a little unexpected it was this quick, but we're not anywhere that I'm personally terribly concerned about at the moment. We've talked about the random tests. We would love to be able to do a random sampling. We've talked about even when Carmen was here to get a general picture of not just the people that may have been exposed, are they sick or not, but actually sample the general population to say, okay, well, out of the entire population, this many people are sick or exposed. And she's right. We have a little bit of an issue trying to get that many people through. We had an issue beginning with tests, which we're able to get now. But as far as the processing and getting those people through there, and then getting a really good sample set, because your conclusion is only as good as the data that you put in it. So you have to get a really good sample that's indicative of your population, which includes the various ages, ethnicities, are they working, are they retired, do they go to church? It's very complicated to come up with that 100% mathematical process, but it's something we would like to do if we're ever able to get to that point. But I'd like to reiterate what Kathy was saying. A lot of what we're testing is that contact tracing to go after those folks that have been exposed. So obviously our numbers are going to be up a little. The model that we have to do remote testing that our office uses, we can run about 46 tests an hour, somewhere in that neighborhood, which is what we did last Thursday. We made a few modifications to that, so realistically we can do about 60 an hour, which is about 1 a minute. That's a lot. That's moving some folks through, but then you've got to have all the logistics after the fact to process the test, get them to the lab that will take them, get them there in the timely fashion that they have to be there so your test results are accurate. Because it doesn't do you any good to go through that process and not have an accurate result at the end. So there's some logistical things there that we just need to tweak, or the system that's outside of our control might need to tweak in order for us to really push real big numbers through there, but we're working on that. We do have some non-congregate sheltering for Kathy, and somebody asked the question about are those folks checked on? Do they stay in their, or do they abide by the orders that they have to stay put? And for those folks, we have a little bit more contact with. Typically, those folks will stay about an average of 8 days in non-congregate sheltering, which is usually a hotel room somewhere so that they're away from everybody else. It's reimbursable by the federal government, so we have to keep track of all that, submit reports every week to that. We've had them as little as 4 days. We've had them as long as 18 days. So it just kind of varies. It varies on the patient and how many follow-up tests they have to have. So that's kind of 8 days is about an average for those folks in there. And then on the supply chain end, we've been involved with some other things. I guess it's been a couple weeks since I've been here. The nursing homes, assisted living facilities, and the group homes all got a 14-day shipment of PPE based on their daily burn rates about 2 weeks ago. We're starting to see some smaller shipments come in. We took some shipments to some private providers this past week that have placed orders through the North Carolina system. We do have that weekly or bi-weekly phone call with the management folks at the hospital. So to answer your question, yes, they are ramping up. They have the ability to surge past they have, as a critical access hospital, they have a certain number of beds that are staffed. Then they have beds that may be vacant over here, but they're vacant because they don't have staff. They have a plan in place to surge their staff to fill those beds if necessary. And then they actually have a waiver or a provision in the rules now that their other facilities, like their off-site facilities, or for instance their outpatient surgical locations, they can turn those into treatment rooms if necessary. And I may not be using the exact terminology in the hospital world, but they're able to surge. They have a plan to surge up, and there's a percentage that they're allowed to do that on top of the space that they already have. So they do have some arrangements in place. Ventilators, there was purchase order cut with North Carolina. I can't remember the exact number they were going to purchase. It was in the millions of dollars. When we actually asked for those to start with, basically what they told us is those would be in a stockpile and would be sent out whenever you hit a certain threshold on your local facilities. You know, if they've got 5 and they hit the 3 or the 4 mark, then they put the request in and they start sending them in. Now, obviously you have to make sure they get here in time, but there is a plan in place to get those here if that becomes necessary. Unfortunately, at this point, it hadn't been necessary for us. So with that being said, that's about all I have tonight, unless anybody has any questions for us. One of the things I did say at the press briefing that we had, I guess a week or so ago now, people wanted to know, are we looking at any further restrictions? And you remember I told you that when we went to the governor's executive orders, we deferred to those as any kind of controls here in Macon County. We would have a plan in place that we could get a little more stringent or a little tighter in Macon County if we had to, if we saw the numbers getting off track. I don't think we're there. I don't see that in our foreseeable future in Macon County. Obviously, we'll keep an eye on it, and if we had to do something, we would, but we're still comfortable, in my opinion, at this point with the governor's orders. As a matter of fact, hopefully there'll be some other changes coming to them soon. So.
Thank you, Warren. Any questions?
One of the most calls I've got is the question I asked Kathy is, we've got several today, as a matter of fact, that they're really worried that these people who are supposed to be in isolation are not in isolation, and they're out and working, even Kathy said, and this lady that called me today said that they know that this person tested positive, and how big of a concern is that, Warren, to you?
It is a concern, and Robbie may want to speak to this when he comes up here as well. One of the issues we have, and this is the process that we undertake when that happens, if we have a concern brought to us through my office that somebody's not obeying an isolation order or quarantine order, I can't remember which one's which, Chester.
Isolation is where you
isolate.
You are all by yourself.
Yeah. When
not
Kathy,
going anywhere.
When Kathy makes the decision and they sign the paper and say, I have to be here for 14 days, when we get those complaints, then what we do is we immediately contact public health. They have that follow-up process that they go through every day to contact these folks. So they'll immediately follow up. We have sent law enforcement to make some visits occasionally. But typically what happens is once they get that phone call, it gets explained again that, this is why you need to be here. Now, are we going to fix every problem? No, we're not. We don't have the manpower to put a deputy at every house that has that order in hand to stay there. So what we try and do is paint with a really broad brush and catch as many folks as we can and work with as many folks as we can to maintain that. In the case that we're going to have some outliers, we'll just have to deal with those the best way we can.
Understood.
Thank you, Warren.
Thank you.
All right, Sheriff Holland.
I don't have a whole lot. We're still continuing to bring inmates through the Sally Port out at the command trailer. We first process any of our inmates there before we bring them into the jail. That's still going really well. We don't have the tents out there anymore, but we're still continuing to address that out there. Visitation for inmates is now occurring over at the Robert C. Carpenter building, where a family member comes to the Robert C. Carpenter building. I have an officer that will stay over there with an iPad, sets it up for the person, and then the individual that's incarcerated stays at the jail on the other end, and that's how they do their communication. That's continuing to work out really well. We appreciate the Rec Park working with us and making sure that that room is available. I'm going to continue that long after our county and state open. I think this is going to be a long process on the visitation. I want to keep as many people away from there. We're still housing inmates. We're still taking in individuals who have been arrested. We have individuals who are able to make bond prior to coming to jail, then they don't have to come into the jail. It works out good for us. We're not doing anything trying to keep somebody out of our facility. If they've committed offenses out here in the public, we're not putting the public at risk. But we are making the normal steps that we would make for anybody else, because what we don't want to do is bring somebody who's probably going to bond and go through that process and then bring them into our facility, and then they've infected us with COVID possibly, and so we're doing that. They're being tested when they're in our facility, and things are going well. I appreciate my staff. They've worked with the health department in many different ways. Josie Alonzo and a couple of our other Latinos that work for us have been part of doing the translation and doing a fabulous job. Be honest with you, they're worried when they're having to deal with these people, because they're not used to be in the health field. They're in law enforcement, so they don't quite understand everything that goes on. So it makes them have some concerns, but they're doing an outstanding job. Trying to think if I'm leaving anything out. We have spoke with the director, the health director, on situations where people weren't doing exactly what they've asked them to do. It's my understanding that that's been able to be corrected once we got involved. The health director made contact with us, and they understood, once law enforcement was involved, that, it kind of steps it up a little further. And it's my understanding that they've all complied from that point, that if we did have to get involved. I can tell you we've not charged anybody, we've not put anybody in jail. So I'm under the assumption that everybody has done what the health director has asked them. We've not had to take it to that next step.
Good job, Sheriff. Thank you. Any questions? Sheriff?
Thank you, Sheriff.
Thank you. Appreciate it. Just so you'll know, everything went really good today with the protest. I'm really proud of both our agency as well as the Franklin Police Department and some other organizations that were out there. Everything went really smooth. You had a little bit of concerns get made from one end or the other, but it ended up being absolutely nothing. Everything went really smooth on both ends. I think it's important to know that we did not organize or allow this protest. They went through the proper procedures and steps to have their protest. They did it through the town to be able to be held on the gazebo property, and we provided security along with the police department, and not only for the community, but even the organizers of the event. We met with them previously, both me and the chief, and they asked for us to be there, so we had plenty of people. I will tell you that the entire event was videotaped, and the reason that I videotaped that, or had one of my officers videotape, is we've seen things happen in other places, and so I wanted to take those precautions to have it videoed. I had to deal immediately with the fact that somebody started the rumor that we had snipers on top of the buildings, and so I immediately contacted the source of that information and quickly corrected that with them to let them know that that's not true. We also went to the organizers of the event to let them know why we were on top of the roof and what we were doing, and they appreciate it. But I have a feeling that you may hear about that, and I will tell you we did have people, law enforcement officers up there, and they were there at my direction, and they took videos, and were able to also respond to anything that we had happened. But I'm expecting for that to be the rumor, and so I wanted to clarify that ahead of time. Thank you.
Sheriff.
Thanks, Sheriff.
All right, Mr. Manager. Eric Rowland, I think you're going to give us an administration update, and you have the next item too.
Yes, and I'll
regarding the Recovery Act funding.
Okay, and thank you, Mr. Chairman, and I would just like to say very briefly, update from administration. You've heard from our health director, you've heard from our emergency management director, as well as our sheriff, and I would just like to say that each of the updates that they've given and the statistics they've provided, when you look at it from contact tracing to test administration to weekly EOC calls, that's keeping not only our county staff, but our hospitals, our school system, our food banks, all the services in Macon County, keeping those coordinated in this effort that we have been trying to put forth in response to the COVID-19 pandemic for quite some time now. And I would just like to say I've never been part of a more coordinated, well-planned, and well-prepared effort. And that's a direct result of the people that have just spoken here tonight, and not only from the front lines, but to finance, to HR, that have implemented leave policies that have came about as a result of this, and had to reinvent the way we've done timesheets and accounting for things with teleworking, so on and so forth. All across the board, transit, putting barriers in their vehicles, maintenance with the enhanced sanitation efforts, and because of this organization-wide effort, both on the front lines and internally, we have been able to continue functioning here in Macon County, continue to remain open for business, and continue to provide Macon County citizens with the services they depend on. And I would just like to thank not only those folks I named, but the employees and department heads across this organization, as they have all stepped up to the plate and done their part in helping us fight this pandemic. So with that being said, Mr. Chairman, I will get right on into the CRF funding, the CARES Relief Act funding that was passed down from the state of North Carolina. As you will recall, we received $833,421 in CARES Act funding, and I'll pass out a sheet here that we have came up with for distribution. As you'll recall, we discussed previously, these funds have to be spent by December 31st of 2020, and they're for expenses that were incurred March 27th, 21st, or from March 21st up until now, as well as those costs we foresee coming down in the future. You just heard from our health department and Warren Cabe, who is also now assisting in the testing effort, and saw the tremendous number of tests that we have administered when compared to those surrounding us. We have budgeted funding for that in here. There are processing costs associated with those tests, and we will use the CARES Act funding received by the county to go towards covering those. Quarantine expenses for those people that have been ordered quarantine, for assistance with those expenses, whether it be hotel costs, etc. There's funding in there, as you will see, for that. PPE, not only for our front lines, but in offices as well, such as DSS, senior services, transit, the maintenance department that's in and out of every building. We have allocated $138,421, as you will see, to go toward those measures, as well as disinfection efforts as well. Public safety measures, we've installed protective barriers. At many of the buildings, we have bought sanitation equipment. We have increased our sanitation stock, sanitation supplies. We have increased the stock of that. As this thing was escalating elsewhere, as Warren mentioned, for a long time, we were at the bottom. We were not really seeing any increase in cases. But what that has allowed us to do is it has allowed us to become tremendously prepared, and we remain prepared today as we see that rise in cases. These funds can also be used to go toward those frontline payroll costs that are associated with individuals out there, Macon County Public Health, emergency management, law enforcement, if they're involved in the COVID effort, doing something with that. Those can go, funds can be used to cover those expenses. $370,000 has been budgeted to cover those payroll costs incurred by county employees due to COVID-19. And just to give you an idea, this is about 1 month of EMS and public health payroll combined. So it is not a windfall. Again, it has to go to costs directly associated with the COVID-19 pandemic. Public employee sick leave, this what comes following legislation passed as the COVID-19 pandemic with the onset, that allows employees, whether it be for child care, whether it be a diagnosis with COVID or caring for someone with COVID, they're granted emergency sick leave, and these costs go towards offsetting those expenses, paying for their sick time while they were out without the county having to assume that. I mentioned telework earlier. We have telework arrangements in DSS and other county offices throughout the organization. That has came with a cost. Again, the cost is at this time. We don't know how long we're going to have to do that. We don't know when your agencies like DSS that have the numerous people piled in an open area with cubicles, it will be determined safe to be back in that congregate atmosphere without fear of spreading of that. Jail improvements. We had rented a couple tents, as the sheriff had mentioned, to process inmates, so on and so forth, to do virtual visitation with inmates. We have since gotten out of that arrangement and started using the Robert Carpenter building. Nonetheless, costs were incurred there, and with the virtual inmate visitation and the processing of inmates outside of the center, for the foreseeable future, as the sheriff mentioned, we anticipate continuing to accrue costs there as well. The economic support grants, as you will see, no funding has been included there. We have appropriated tonight, as you gentlemen just have done, out of the EDC Reserve Fund, the $257,000 to go toward the Small Business Loan Administration. And lastly, and certainly not least, it was contemplated as this funding came down that the county would be tasked with distributing funds to each of the municipalities, and in doing so we have distributed $60,000 to each of our municipalities. We have spoken with the town of Highlands, received communication from the town of Franklin on May 31st. Up until May 31st, they had incurred about $10,000 in costs associated with COVID-19 with the figures they provided. We will ask that the town the municipalities have a deadline of October 1st for submitting these costs to us, because we're going to have to get all of our paperwork ready, plus that paperwork ready, and to be turned in to the state by the December 31st deadline. I'll remind you again, this is, we originally approved it before they extended the deadline. It was June 1st, then they extended the deadline to June 15th. So nonetheless, this is, it does represent a revision from what was originally approved and sent in. This is ever changing. So if we can reallocate as necessary the portions of this, should we see it be needed elsewhere, additional funds be needed in testing, we're able to do that, and we can continue changing this and revising it up till that time. So with that being said, Warren, do you have anything you want to add to?
No, I just want to reiterate, particularly the municipalities, that those monies, I think we'll probably ask them that they will have to submit the same criteria that we do or to be eligible, because Macon County is on the hook for that money. If that money is spent inappropriately or not spent, we have to pay it back. So therefore, we'll have to ask them to do the same process.
Yes.
Is there a need for an agreement with the municipalities in that regard?
Agreement never hurts. I would say, well, I don't know, because
I know some counties are doing them.
Well,
and if we've not done one, you might want to give some consideration to it.
I think if they're submitting the paperwork and it was outside of the scope of what we were supposed to do with the funds, then, I don't see us submitting that on to the state. So there would never.
That's obviously above my pay grade.
Is the money released to them only upon submitting the appropriate paperwork?
Yes, it's going to be reimbursed.
If that's the case, I think you're in fairly good shape.
Yes.
And we'd also like to say what we want to do is have them, their first allotment, to have that back to us probably by the middle of October, because obviously if we don't have it spent by the end of December, it reverts back to North Carolina. So that gives them time to get their stuff together, to assess their costs, to submit that to us. Then if they either need more and we have some available in these other categories, all we have to do is Lori has to submit an amendment to the NC Pro folks with North Carolina. We can move those into categories. So that allows us time to go through and audit the monies, make sure that reconcile the different categories, and then if we need to move some around and put in different categories, we've got time to do that before the end of the year. Some of these expenses, you've heard me talk about PA monies, public assistance monies. Some of the same things that are here can be paid for with PA monies. But if you remember the last time we did PA reimbursement, it took us about a year, Lori, somewhere in that neighborhood, to get the reimbursement. So this is a whole lot more expedited. Matter of fact, the money's already hit our account. So it's a whole lot more expedited for us to go through the process to send the paperwork in to justify the monies. Also, your PA monies typically have a 25% match, which North Carolina usually takes care of that 25% match. There's no guarantee on that at the moment. So this is 100% guaranteed money. So it's much better for us to use 100% guaranteed money first, then go to the 75-25 after that. It's just better for us financially.
Mr. Manager?
Yes, sir.
Further?
One thing, Mr. Manager, appreciate you going through and talking about coordination and specifically different departments within the county that were able to work together. But I think one person that you purposely omitted from that is our quarterback, and I think it's crucial that we have the right person in times like we're going through that can coordinate that stuff. So, thank you.
Yes, sir.
Stay right there, Mr. Manager.
Okay. Moving right along.
Consideration of Macon County Forest Advisory Committee recommendations and comments. Mr. Manager, as you know, gosh, it seems like 2014, I think, some of this discussion started. So it's been going on for 6 years, roughly, and it's finally starting to come to fruition. As we all know, U.S. Forest Service provided an initial plan and then passed it along for further feedback. And so we established a committee to review that plan. And we chose the gentleman that I know that has attended more meetings than anyone else in this county. There's no telling, Jim, how many hundreds of miles you've driven and how many hundreds of meetings you've attended from here to Asheville to Hendersonville to various locations. And so we chose you to head up that committee and help us find some individuals to serve on it. and we appreciate that and your knowledge. As you know, we took your committee's recommendations, and I tasked our county manager with reviewing that and somewhat condensing it and providing it in a format that the United States Forest Service asked for it to be returned in, and that's what he has done. And I hope you've had a chance to review that, Aaron, and approval with it, and I hope the other commissioners have as well. Because Derek, I think you did a great job with it. So with that being said, I'll let you kind of lead in, just broad brush strokes, or if you don't want to, I'll be happy to.
Well, yeah, I can certainly start off, and you can fill in, and Mr. Gray, you can address the board if necessary as well. But as we all know, the Forest Service plays a huge role in here locally. About 46% of the land that is in Macon County is in the National Forest Service. This effort with the Forest Service, the land management plan, has been ongoing now for 5-6 years. That the Forest Service has been going into this planning phase and getting to where they are now. This plan, when approved, will basically, it will dictate and provide a guideline as to how the lands in the Nantahala and Pisgah National Forest are going to be used for the next 15 to 20 years. In recognizing that, I think it was a tremendous foresight on part of this board to organize a committee that was made up of such diverse representation, from members from the home builders, to hunters, to planners, to hiking enthusiasts, to GIS specialists, wildlife enthusiasts. I think it was very good to get that group together and be able to come to an agreement on the direction that Macon County wanted to see this plan go. A very detailed report was submitted by Mr. Gray, who headed up that committee, that kind of summarized the work they had performed up until now, and I think they have done an excellent job. As you'll look through these recommendations, the recommendations that are listed uphold previous decisions made by this board, or request by this board of no additional wilderness area. Aside from that, these recommendations allow us to, they go to promote more access to the forest within Macon County, and allowing Macon County residents and visitors to utilize the forest to its fullest extent, while not compromising that very the kind of the nature aspect of it. Without it's a great balance between utilization and being able to harvest timber, which is an integral part of our school system funding that we get here in Macon County. So they've done a good job finding that balance between the nature of the forest and being able to provide access, and being able to allow the residents and visitors to use that resource wisely. Again, it is a tremendous resource. You will see these recommendations go towards being sure that not only we get to continue to enjoy it, but generations to come do as well. And with that being said, Mr. Gray.
Just a thank you for the opportunity to put this report together, pull this team together, and do that. And one question, I have some other counties and some other people asking me what Macon is doing and how that's going to be handled. And I have told them that the commission's meeting tonight, as soon as it's public, I will share what the commission approves. But I haven't shared anything yet because it's not official yet. So my only question is, number one, has this summary changed any? It's the same? Okay. And I want to commend Manager Rowan on this. This is a very professional summary. He took what was about a 15-page report and boiled it down to this report, and it hit every button. So I appreciate what y'all have done. I appreciate what Derek has done, and hopefully we'll have a good outcome for Macon County.
All right, thank you, Jim.
Thank you.
Thank you, Jim.
Are there any questions? I've got a few more comments, but any questions or comments? All right, I was just going to mention that I've had, to me, this is a very important document, as the letter second sentence of this letter states that 46% of our land in Macon County lies within the United States Forest Service. And it's the management plan of, I think the Forest Service did a fantastic job with the overall layout of it, and we just provided some, what I would call minor tweaks. But overall, we're not suggesting any significant changes from what's here, what's been going on for the past 20 years since the last plan was done. But I just wanted to mention publicly that I've received some correspondence from people that are in support of this since it was reported, since this came out in our budget. I've received, I believe, one phone call from someone that thought the restrictions were too strict. I have not received a single phone call from anybody wanting any changes. I did receive an email from somebody wanting us to not promote clear cutting, which I don't think this necessarily does. When there are Forest Service lands, it is productive timber forestry practices. And I received probably 3, maybe 4 emails objecting to Mr. Gray being the chairman of that. But as soon as I sent him an email explaining why he was chosen, I didn't receive no correspondence back at all. So I've just received very minimal overall. So if anybody else would like to speak, I'm very pleased with it. I think Jim and his team did a great job, and I think the Forest Service did a great job. And both parties have been fantastic to work with.
You know, we talk about logging and and what that means. I mean, I think they just released a good logging job, and we do think, you know, if you're born and raised here, that it does make a difference. But also, you heard it's SRS money, school resource money. But if you do, the way I understand this, and Mr. Gray, you might be able to clarify it. Supposedly, we supposed to get some tax money from the federal government for every acre of land that we own, which has never been in the line budget at the federal government. We have to go begging every 2 years. But if, I could be wrong, but if it's declared wilderness, which means very limited access, that percentage, now this comes from a buddy in Colorado, we've had this discussion, which is very small anyway, and lucky to get it, right, Lori? Yeah. So if it's declared wilderness, the way I understand it, that formula of reimbursement goes down even further.
I have not heard that.
Well, but that's what he said, and he's in Colorado, which...
That's the payment in lieu of taxes.
That's right.
Money.
Field money.
Yeah, field money.
So I don't really know that, and I don't know what that... But if it's even got a chance of doing that, that reason right there is enough. I mean, just to pass that along, I don't know the factuality on that, Mr. Chairman, but our PILT is a big deal to us. It brings in money that you imagine if this 49% was taxed at our regular tax base, and it's taxed at we're lucky to get what, 300 grand?
It's about 380.
380. So, and that's a fight. So if that is true, and I can't verify that, but the PILT money is very special, and we keep fighting that bull to try to get that money.
I think, you know, we're very lucky to have somebody who's interested in doing this. Jim, from the bottom of my heart, man, I thank you for doing this. It's a complicated thing, putting this committee together. And speaking, I think, on behalf of this board, we're very grateful that you've dedicated as many hours you have to this and come up with something we all can agree with. And
thank you.
Personally, thank you a whole bunch.
I just had my 80th birthday, so I won't be doing the next one.
You don't know.
You don't know that.
Keep your mask on.
There you go.
Just keep the birthdays coming.
You did do this one, though. We thank you.
If you do another, we'll give you an ink pen.
Oh, there's an incentive.
Oh, yeah.
Yeah, I would just echo what Chairman Tate mentioned. You know, I had a few emails, a few calls, and my comments to those folks, irregardless of where they were at with the issue, is that my hopes is that we would end up with a balanced plan, something that would serve all the citizens of our county now and moving forward, and I think we've done that. Jim, I appreciate you, as Commissioner Higgins said, I appreciate the time that you're willing to put into it. It's real easy to sit at home and be a Monday morning quarterback, but you certainly not that. You've worked hard at this, and thank you very much, sir.
And Jim, I don't know how we could go about it, but I still think there's a real gap there in most of our citizens in realizing what wilderness really means.
Right.
And I don't know if that's an educational process, but not that it can change some minds, but if you really knew if you read the full plan of the Forest Service and the definition of wilderness, I think even those who are really think we're going to just clear cut everything. I think that would change some minds. It's not that confusing, but there's a lot of education needs to happen on that. I think, and I don't know how this plan will turn out. I think they extended comment to the end of June,
Right.
and but I think somebody's responsible, if not and the federal government should do that. They should have an education program on what wilderness really means to a community like ours.
And not only that, I'm writing a separate set of comments myself, and I've encouraged signage on timber cuts, explaining what they're doing, why they're doing it. You know, when a hiker comes on a timber cut out there, it's not a clear cut anymore. It's called a shelter wood, or a, they leave some mature trees. But if they understand it's for wildlife, or it's for removing poplar and maple and restoring oak, or whatever it's for, tell the people instead of them just coming on an ugly timber cut. So signage is very important.
True.
All right. We can get a motion to approve this letter. Sounds like we're all in agreement. I'll sign it so Mr. Manager can get it all up and about. Got a motion by Commissioner Gillespie. Second by Commissioner Shields. All in favor?
Aye.
Thank you, Jim.
Thank you.
Derek, I probably better sign that tonight if it's due by the end of June that way. I'll get it off.
Thank y'all.
Thank you, Jim. Happy birthday.
All right,
Well,
so
belated, but thank you.
Just keep them coming.
Yeah.
ordinance amending the fiscal year 2019-20 budget. Lori, anything you want to comment on, or just want us to
Mr.
do it?
Chairman, we need to move item C up till now.
Okay, let's go with the garage tank removal.
You lose my pen?
Lose a pen. Yeah, I did. I didn't lose it. Thank you, Mr. Chairman. As you'll recall, we received a notice of violation, or actually the Macon County School Board, it was addressed to me, received a notice of violation in March regarding closing out of there was 2 underground storage tanks, a 10,000 gallon gasoline and a 15,000 gallon diesel tank located on the Macon County School Bus Garage property. As you'll recall, Dr. Baldwin came in here, we discussed the county was going to work to fix this issue that has been ongoing now and get it taken care of. That same night, we approved a contract with SM&E Environmental Services to contract this work, to get this work done, to get the basically in conversations with the Department of Environmental Quality. We were notified that we had to get the tanks off the property and close it out. And in other words, to show that there was no more environmental threat from those tanks present on the property. In doing that, again, we originally contracted to remove the 10,000 gallon gasoline tank, the 15,000 gallon diesel tank, and backfill, cover that with asphalt. And it was going to be open and closed. Well, when they got into the project, they noticed that there was a release that was determined to be in connection with the gasoline underground storage tank. What this led to was the need to excavate and stockpile an additional 150 tons of material that was in that area where the release was found. With that stockpile came the need for also additional testing of that material and some additional reporting requirements associated with it as well. That is basically what I will distribute to you now. That is the change order that was submitted by SM&E to the county. And basically, we had a conference call with them today, Chester and myself and Jack Morgan, and basically told them we wanted a change order that was representative of what it was going to take to get the state to come in and sign off on this project, sign off that the notice of violation has been taken care of so the project can be closed out. So what you have here is a change order in the amount of $12,361. It was originally $17,004, but where we had asphalt or concrete going back over the area that was disturbed, we're now gonna redo it with ABC stone. That'll save us an additional $5,000 on the project. That $12,361 does not include the haul bill. We were able to get that done locally for a better price. So we're going to, what SM&E will do is submit to us the paperwork associated with the fill material that the company that is hauling it has to have to turn into the site that's receiving it. They will submit us that paperwork associated with the fill material. Under the terms of this contract or this change order, they will install a monitoring well. They will revise the report that was associated with the original project to include the release that was found and the actions taken to mitigate it, and the $11,000 was associated with the excavation and testing that was required for this material. So with that being said, the original price for this project is $52,800. This we'll be requesting $21,000 to go towards this change order. When we get this change order done and the state receives that report that they have given us, when they'll go back and test that monitoring well and see if there's any, based on what they find in this course of action with the installation of the monitoring well, that will determine what, if any, next steps are necessary. But what we would like to do, and what we have began doing already, we are working with the school system to look at their property and liability insurance. There is, right now, there is some coverage in there for pollution. We have our property and liability insurance agent working with them. Chester is going to get in touch with their attorney. We're going to be pursuing that avenue. There's also some reimbursement avenues we can pursue through the underground storage tank system with the state to get reimbursed for some funding associated with this. So, this is a problem that, we were presented with March 6th, given a June 1st deadline. We've met the deadline. We're continuing to work with the state. We're going to get the issue resolved. And it's a problem that we were going to have to take care of one way or another. So,
Mr. Chairman, just for the record, we want your liaison committee and the county manager, we asked repeatedly if all areas have been tested. I have never seen a tank removed. that didn't have to either cook the dirt, haul the dirt away, and the county manager can vouch for that. We've asked repeatedly, had all areas been tested that should be tested? Because I've never seen one move. You think one right across from Commissioner Gillespie's office, that's a prime example. Right there across from your office is a prime example. Down here at the old Simpson place, prime example. That's the reason that we asked that this company check everything, and I guess.
Well, and see, part of that too was we had approached the Department of Environmental Quality and asked if we could leave the tanks in place, fill them, close them off, be done with them. And we could not do that. We had to have the tanks removed. The only way that you're allowed to fill in place and not remove the tanks is if they're located next to a building, a significant building, where bringing those tanks out of the ground would result in damage to the building. There was no significant structure there. It was just the tanks, and so for that reason, that option was taken off the table. So we had to go in immediately into removing the tanks as DEQ required us to do, and so that was just it came with the job. It was the testing would have been $11,000 that we would have had to pay to test around, but we would have had to pay that and then still remove the tanks. So it was.
The problem is it ain't over.
For clarification, though, they have tested the 150 tons of soil, and those tests we'll be getting a report on that. Also, if I understood correctly today, wherever they had a wall from that excavation, they tested into that wall as well, and we'll be getting those reports as well.
Right. So. And we were just saying to do it before.
It won't ever build. I'm telling you.
There are a couple questions.
Yes, sir.
The change order to SM&E is for $12,361.
Yes, sir.
And then I thought I must have misunderstood you.
20. We'll be requesting 21,000. There's going to be a haul bill. We got a better price locally on hauling, $8,600, as opposed to I think they were like $12,000. So that's where that other.
Where's the dirt? Where we hauling?
It depends. It depends.
No, I think they indicated that they were going to be taking this towards to Shelby area.
You can take that.
That's only if depending on, see, they've submitted all this to the state and they're awaiting test results on that stockpile material. When the test results come back, based on what's in that material, it's going to depend on where it has to be hauled.
That's right.
You see it go to Barnwell, South Carolina.
I don't mind as well.
Lori, we were able to get funds from contingency as well as non-departmental.
Yeah, the work comp line and contingency.
To go towards covering this, so it can be covered with the year-end budget amendment. And again,
There's a school on that property.
Yes.
Do they have any? We've asked this question, and I thought they had like $400,000 that they might contribute to a bit to this.
So I think the majority of that had been encumbered.
Can't get nothing.
Technology money, yeah. They've already ordered, they just haven't received their items.
This is my daughter.
You know that young one?
Come back here.
And so,
It's gonna be raining.
Fishman Hall was done.
DeSoto Trail.
Total cost before, total cost after.
Total cost before was $52,800. Total cost after will be $72,801.
Commissioner Bill said, and it just goes from there.
Right, and this is to get, like you said, the state's going to come in when this monitoring well's installed, and they're going to check, and they're going to tell us the next steps, where we have to go from there.
One key though here is this property is owned by the Board of Education, and we need to bring them to the table and make sure they understand what's going on and what may have to go on from here. This project was to get in immediate regulatory compliance, and I think what we've done will probably get us there, but we may have some other things that we'll have to look at as well.
That's the reason some of us was a real proponent to spend that $11,000 to get the testing. That would put these people on the hook. But now you'll see it after the 70. We've just seen it too many times. It just, when you get that state report from the dirt, you just never fail.
Mr. Manager, I hope you'll chalk this up to learning. You think we saved enough on diesel by having these own tanks or gas to pay for this? Or in the future, would it be better to pay for gas?
That's why I think it's important, like Chester said, we need to get to school. We need to sit down with the schools, get them at the table, and discuss some of this moving forward.
New tanks have not gone in out there. That's a discussion that still needs to be had.
That's what the thing is, the county going to be paying for it in another 20 years down the road like we are now.
Well, they do them a little different, I think, now. They do like double wall type things, and I think they've got systems to at least minimize that.
We'll do this, and it's school's problem. School's problem.
I think ultimately it comes back to us anyway.
Yeah, tax dollars, tax dollars.
Make that a motion, Commissioner Hoogan.
No, I'm not there either.
We need to move it forward and get closure on it. And so, are you asking for the 21,000? Or are you asking for 72,801?
We would need to 21,000 to finish the
And to
project.
approve this
Approve the
agreement.
change order.
Approve the change
Proposal.
I'll second Mr. Shields' motion, but Mr. Chairman, we need, because there's a lot of these schools still have these tanks. Don't be confused, and this is a lesson learned when you're dealing with this.
Yeah, and you know, we kind of talked about where there was a lot of unknowns, but the only thing that was known was that if we didn't get the tanks out by June 1st, we were going to start having to pay penalties. Or the schools Board of Education would have been having to start pay penalties.
And then they'd be asking us for the money to pay those penalties with.
Yeah, but you could ask also for a waiver. If you have a company like this that's certified through the state, and they're doing the testing, you ask for a waiver, and it's granted.
All right, got a motion by Commissioner Shields. Give a second.
You did.
I
Second by Commissioner Bill. Any further discussion? All in favor?
Aye.
All right, thank you, Mr. Manager.
But I know we had a tank there at times.
So then we need,
We filled it up.
we're going to be approving option 2 then with the budget ordinance, correct?
We need to approve option, sorry.
Option
We need to
2
make some slight
does
changes
include-
because of the $21,000 that y'all just did. So yes, I need a motion for you to approve option 2, please. But we need to make 2 changes. Education, as in your packet, is $10,471,863. We need to add 21,000 to that because of the motion y'all just made. So that new number would be $10,492,863.
Okay.
And we're taking that money from non-departmental. So in your agenda packet, it's at $2,123,670. We take the 21,000 away. The new number will be $2,102,670. And of course, I'll be sure to give the clerk this corrected copy.
Good job. We'll get a motion to approve the
Thank
same. Motion by Commissioner Gillespie, second by Commissioner Shields. All in favor?
Aye.
All right, moving
Thank you,
on
Lord.
to new business, grant request for Highlands Cashers Health Foundation. Mr. Warren Cape, welcome back, Warren.
This will be very brief. If you remember, I came to you in May to ask for a grant request from the North Carolina Healthcare Foundation, and which y'all granted. They had a very quick turnaround time and have already denied us, so therefore we didn't get that one. But now we have an opportunity to apply for the same EMS equipment for the most part through the Highlands Cashers Healthcare Foundation. So I'm asking to resubmit that grant to the Highlands Cashers Healthcare Foundation in the amount of $101,250. $200 for EMS equipment that requires no match.
You got a motion to
So
put the
moved.
same? You got a motion by Commissioner Higgins, second by Commissioner Bill. All in favor?
Aye.
Thank you, Warren.
Thank you, waited for that.
All right, item 11B, resolution concerning participation in the Southwestern North Carolina Home Consortium, Southwestern Commission.
Mr.
Executive
Chairman,
Director
in
Sarah
your-
Thompson.
In your agenda package, you had an agreement as well as a resolution. After those were put in the agenda package, we received communication from Region A with a slight modification to the agreement, which required some language change. So I have brought to you this evening a revised agreement and revised resolution that would take care of those necessary changes.
Hello, this is Sarah.
Hey Sarah, it's Jim Tate from Macon County.
Hello, Commissioner, how are you?
I'm good, thank you. Thanks for your time tonight.
Good.
8:15, so not too bad. Any comments you'd like to make to us regarding this? Or the rest of the...
I think it's probably best for me to answer any questions you might have. It is fairly straightforward. The step we're in the process is to form the consortium. The dollars that we bring into the region are based on the population in the consortium. So once we get member governments to join on, then we take the next year to form a plan for how the money will be distributed and spent. So it'll be summer of 2021 before we actually receive funds and start the program. And you will have a representative on the committee that forms the board and that oversees the allocation of the funds. I think it's also important to recognize and to know that you're not committing yourself to any money right now or binding yourself or future boards to any funding by joining the consortium. Any dollar that's allocated in your jurisdiction will come before, those projects will come before your board before we fund them.
Mr. Chairman, this is the home. We've had this conversation with, as on the executive committee of the Southwest Commission, and what this is a federal block grant, and there's probably about $600,000 available to our region, who we've never applied for. Is that correct, Miss Sarah?
About 800.
Yeah, it's, we've been studying housing for a couple of years now because it's risen to the top of one of our regional issues. And through our examination of the issue, we discovered that these funds exist that we're not currently collecting. So it comes into the state, but it's not coming into our region right now. It has passed through the Southwestern Commission the same way other funding passes through our agency, such as our aging funding. So eligible entities, such as a nonprofit or a local government, will apply to us for the funds. The project for which you apply meets the criteria. We will then take the grant of the funds and then we monitor how it's spent. So it's really managed pretty identically to how we do our other programs. So it's a good fit for us.
And this is usually done in a partnership, either private or public. And I think Sarah said it, if you remember last year in 2019, there was a housing study done for the need of low-income housing. Now,
yeah, every single county has the same results in our analysis, which is that there's a lack of low-to-medium income housing.
of course, the latest study out is for, you can build a house, put them in it, or some kind of shelter and put people in it, and it's still cheaper than sending them to jail. So, I think this is an opportunity that we can, if we want to take advantage of it. I think, the county has control if you want to approve a certain partnership to get part of this money, or we've just never tried. So I think we should, Chairman, I think it's time we put our name in the hat.
Sure. We'll make that in form of a motion that we approve
That's
the agreement.
There is a resolution that I prepared for use in connection with that this evening.
If you've not read Chester's resolution, it really spells it out well. And so I make a motion that we approve the resolution as presented and become part of the consortium but the main thing is it does not obligate our county to anything.
And that's the correction that was made.
Yeah, it does not obligate our county to anything.
Got a motion by Commissioner Bill, second by Commissioner Childs. Any questions or further discussion?
Who's the beneficiary of this program in Macon County?
The
individuals with low-income housing needs.
Low-income families. You have to meet the threshold to be available to do that.
And this lays the groundwork. Maybe you may not see a program in Macon County the first year, but it lays the groundwork for this consortium to work together in future years as well. So
it's the entire the 7 Far West counties, Bob. That's who it's involved.
And we'll certainly be able to leverage these funds for additional housing funds. These won't, this is just a drop in the bucket, and that when we have money to put on the table, we can really get some projects rolling. The immediate uses for these funds would be the nonprofits that already do housing rehab on existing housing. We already have groups in the region that do that type of work that would be eligible for these funds as well.
All right, thank you, Sarah. Any further questions? All in favor signify by saying aye.
Aye.
Thank you, Sarah. All right, item 11C, I believe the chief of the Eastern Band had asked us to have a letter of support. Can y'all give us a little more explanation, Commissioner Bill, Commissioner Wesley?
And Carl, and certainly Carl can speak to what this is. The Catawba tribe has come across the border from South Carolina into North Carolina County seeking permission to build a casino. Because, and first of all, if you read the law, and that's just what the Eastern Band and the chief is dependent on, you have to be part, and it has to be reservation land before you can build a casino. This would be the first time ever that they would allow a casino to come across state. Not South Carolina wouldn't permit it, so they came across North Carolina. And what if it's approved, it would be a big drain. Is the fear it'd be a big drain on the revenue and the jobs that it furnishes for not only this county but a lot of Far West counties. So we're not asking that we prepare the letter tonight, but this thing is, you're going to see it progress along. But in a nutshell, it's going to end up, it's already in court now, and it's going to proceed on to whatever level they think, because our 2 senators sort of signed off on it and said, let's examine it and see where we go. And I don't think they realize what an impact, a negative impact, because about 40% of the revenue comes from around the Charlotte, Mecklenburg area in there that comes through Harris and Cherokee.
Who will hold title to this property?
And we don't know that. Oh, it will be, they're buying the property.
I had understood the gaming provisions only applied for casinos on tribal trust lands.
That's what we understood too. And until our 2 senators decided they would let them examine that possibility of moving out. So that's where we're at. What I'd recommend is that we have somebody in the Eastern Band. The chief is certainly willing to come before this board and explain further. And have been resolutions already passed, of course, Cherokee County and some other counties, Graham County. But just to show that our area is in support, whether you believe in the gambling part, that's not what we're talking about. But what it does supply I don't have that number, Carl. You may have the number of jobs from Macon County, but it's significant. It's very significant. So
That email that the chief sent out included a brief from their attorney, and they have a significant company outfit that's representing them, and they have a very strong belief that they have a very good case. Also included was a sample letter that we could use to show support for that. There was also a spreadsheet type sheet that showed the numbers that Commissioner Bill was talking about. But I think at the end of the day, you know, we, Macon County and all the western counties, certainly those in the 120th House District, benefit economically from the Cherokees. So I think we need to, I agree with Commissioner Bill. I don't think we need to act on it tonight, but I think everybody ought to read and think about it and see if that's something that
did everybody get it, number one?
I did not. I'd be interested in reading
Okay,
the brief.
we'll see to it it's forward. Did every other commissioner get
I
that?
apologize for sending it to you.
Can you see to it everybody gets another copy?
I received one. It came to my county email address.
It's in your county. It can come to you personally.
I'll get it to you tonight.
Okay.
If you'll send it back out there.
Need help with my county email someday.
You got one.
I know, I've never been to it, don't know what it is. Probably full.
I just seen
Oh, it's full.
It's like your phone.
It's right there at Kings Mountain is what they're talking about. You got South Carolina, part of that letter talks about South Carolina, and they just moved across the county line into Kings Mountain, which is in Cleveland County, which is North Carolina. So there's a little bit of friction there.
And of course, you have those counties there, Gaston and Mecklenburg and all those. They're seeing that revenue source too. So it's going to be interesting, but it's going to go way deep into court. It looks like.
I believe some
Don't you agree, Carl?
Yes, sir. They're already fired up in federal
Yeah.
court. So
Oh, yours loaded. That's good. We're ready to go.
All right. So where do we come with this? We're going to send this letter out. I guess we'll discuss our next meeting. Should we ask the chief to come?
He'd be more than happy. I can certainly send out that invitation.
Carl, think it'd be a good idea?
I think it's a great idea. I think everybody needs to.
Yeah, you need to hear, and it's hard to hear both sides of that argument, really. But the only side we care about is that it's a possible job loss. It's huge, and those numbers. I have those numbers, but I don't have them with me, Chairman. I'm sorry.
Sounds good. Thank you. All right. Moving on to the consent agenda, we added 3 items: the lease with Tico at the Business Development Center, the contracts with the Highlands Chamber of Commerce and the Franklin Chamber of Commerce. If there's something that Commissioner would like removed for further discussion, we'll do so. If not, we'll entertain a motion to approve the entire consent agenda.
I got just one general question. Sure. In regards to MN and O, those are just renewals.
I'm sorry.
The
Tico.
Oh, yeah, those are renewals. You're right.
That's all just renewals. Thank you.
I serve on those committee of Franklin, Nantahala, and I make a recommendation to approve on our consent agenda.
Okay, we got a motion to approve the consent agenda by Commissioner Shields. Second by Commissioner Gillespie. All in favor? Aye. All right, we have some appointments. Library Board, we have 2 seats.
Motion to approve, Mr. Chairman.
Yeah, let me read those names out. Paul Alter has taken the place of Lenny Jordan, and Bill William Trotter has taken the place of Andrea Schmar. So we have a motion by Commissioner Higdon.
Good people.
I agree. Second by Commissioner Shields. All in favor? I don't know about this next appointment or not.
Well, I've studied a lot about this, and I've called
Southwestern
Mr. Chairman, I'd like
Board of
to
Trustees.
proudly make the motion that this board send to the Southwestern Board the recommendation of reappointment of Commissioner Gary Shields to the Southwest Commission
Community
Community
college.
college.
Community college.
We have,
Even though he don't know where it's going, he made the motion. That's good, Roddy. And I would enthusiastically second that. I had opportunity to serve with Commissioner Shields on that. He certainly has a passion for that institution, and I hope that we would see fit for him to continue that.
we have a motion by Commissioner Bill, second by Commissioner Gillespie. I'm sure this is going to go to discussion. All in favor?
Aye.
Congratulations.
It says same pay, Commissioner.
All right.
That was close, Gary. I didn't know.
Same pay rate.
Is there any other business to come before the board? Any reason for a closed session? Any further on? Okay.
Motion to adjourn, Mr.
I have a
Chairman.
motion by Commissioner Hagan to adjourn. Second by Commissioner Shields. All in favor?
Aye.
Thank you all for coming.
Can I get a couple of signatures from you, Mr. Chairman?
Yes, sir.
Derek?
Ronnie, what do you think about that continuing education for contractors?
I think it's all.
I meant to bring that up tonight.
I think that's just
This is Bobby. The meeting is adjourned.
Just like
I will try to cut some clips out of this over the next few days if I can.
It's 200.
Thank you all for watching.
Plus where you have to go to. I don't know. So, all down there.